If you've ever woken up with this really stubborn ache in the side of your face, or, struggled to just chew your favorite meal, you know exactly how frustrating and mysterious jaw pain can be. It's like a giant puzzle. You can't quite see what's wrong, but man, you feel it with every single bite and every big yarn. Well, welcome to this explainer. Today, we're going to demystify that entire diagnostic journey for you, step by step. I want to start right off the bat with a question that's probably on the minds of half of you tuning in right now. Is that weird jaw clicking normal? You know the exact sound I'm talking about. You open your mouth wide to bite into an apple, or you let out a big stretch and a yawn and pop? Sometimes it's so loud you actually wonder if the person sitting next to you heard it. Look, if you've been feeling anxious over those strange noises echoing in your head, you are completely validated in wondering what on earth is going on in there. Section 1. Understanding your jaw pain. To really answer that question about the clicking, we first need to get a handle on what dentists actually call TMD. Okay, let's dive into this. TMD stands for Temporomandibular Disorders. Notice how that's plural? That's because TMD isn't just one single problem. It actually covers a whole umbrella of over 30 different conditions that mess with your jaw joint and your chewing muscles. That is exactly why your symptoms might feel so incredibly varied and hard to pin down. You might have jaw pain, stiffness, or those clicking sounds we just talked about. But you might also get terrible headaches or this really dull ache right around your ear. A lot of folks actually think they have an ear infection, when literally it's their jaw acting up. Now getting back to that pop and click. According to the National Institute of Dental and Craniofacial Research, there's a pretty clear dividing line between what's totally fine and what needs a look. If your jaw pops but it doesn't hurt at all, that's often completely normal, harmless, and honestly requires absolutely no treatment. But if that pop comes with pain, stiffness, locking, or you just can't open your mouth all the way, well, that's your body's alarm bell. That painful clicking indicates a disorder, and it means it's definitely time for a professional evaluation. Section 2. The initial clinical exam. So if your body is sounding that alarm, your next step is sitting in the dentist's chair.
I know fear of the unknown keeps a lot of people away from making that appointment, but I really want to ease that fear right now. The very first step of diagnosing jaw pain is 100% painless. Let's take a look together at what actually happens. Clinics that specialize in this, like Apollo Dental Nallakunta with TMD Specialist Dr. Ancy V Ignatius, take a super structured approach. Step 1 is literally just a conversation. We review your history, figure out your triggers, and just talk. Step 2 is palpation. The dentist simply feels the muscles outside your face and around the joint to find any tender spots. Then, Step 3, we check your jaw alignment to see exactly how your teeth meet. And finally, Step 4, we just measure how wide you can open your mouth comfortably. Easy, right?
It really is that simple. But I have to emphasize, despite all the unbelievable modern tech we have today, this fundamental, hands-on approach is absolutely the most crucial first step in your care. The Mayo Clinic hits the nail on the head when they say diagnosing these issues begins with simply listening to and feeling your jaw. There is just no substitute for a skilled professional taking the time to physically evaluate how your unique jaw moves and functions.
Section 3. Basic versus advanced imaging. But, what happens when that hands-on exam doesn't give us the whole picture? We have to look a little deeper.
There's no single magic test for TMD, so we rely on different imaging based on what we suspect is going on. Think of it like looking at the bones versus looking at the cushions. Basic imaging, like standard panoramic X-rays or a 3D cone beam CT scan, is fantastic for checking out bone structures. If we're looking for arthritis or bony changes, the CBCT is the gold standard. But if we think the little soft tissue disc, the cushion between your jaw bones, is displaced or swollen, we need advanced imaging. That's where an MRI comes in. MRIs are the gold standard for soft tissues, for sure, but they're pricey, so a dentist is only going to choose this option when the simpler tests don't fully explain your pain.
And speaking of breakthroughs, we absolutely have to talk about AI. Artificial intelligence is actually being trained right now to analyze those standard panoramic X-rays we just mentioned. It acts as this brilliant second pair of eyes for your dentist. It scans the image and flags incredibly subtle signs of bone erosion or misalignment that a human eye might easily miss in the early stages. By catching those tiny details, AI helps us prioritize exactly who actually needs to go get that expensive MRI. It never replaces the dentist's human touch, but it sure ensures amazing accuracy and really early detection.
Section 4. High-tech bite sensors. We've looked at the bones and the soft tissues, but what about the actual physical pressure inside your mouth?
Let's introduce some wild modern technology that measures the invisible forces happening every single time you chew. This is called digital occlusal analysis.
To demystify that fancy term, it's basically using computerized sensors, like a system called T-scan, and jaw-tracking cameras to dynamically measure exactly how your teeth come together. Neuromuscular dentistry uses these tools to uncover hidden, uneven bite forces. Just imagine if one single tooth hits a fraction of a second before all the others every time you close your mouth. Over thousands of bites a day, that creates massive, unbalanced strain on your jaw joints and muscles. These digital sensors map out that invisible pressure so specialists can customize your treatment with pinpoint precision.
Section 5. Tracking your daily triggers. So, we've talked a lot about the clinic, but let's shift the focus to you, the patient.
Because you can actually partner with your dentist starting right now, straight from your own home. The whole trend of mobile health and telemedicine is totally changing how we manage jaw pain. There are apps out there now, like JawSpace over in the UK, that give you guided self-assessments, evidence-based exercises, and symptom tracking right on your phone. By recording your pain between visits, you build this amazing, comprehensive diary. So when you finally walk into the clinic, you aren't just guessing about how you felt last Tuesday, you have the hard data to prove it.
Even if you don't use a specific app, I'm going to give you some actionable homework right now. Start tracking these specific triggers so you are completely prepared for your professional consult. Note your teeth grinding habits. Do you wake up with a sore jaw? You might be grinding at night. Track your chewing gum usage, because chewing gum is literally like running a marathon for an already injured jaw joint. Monitor your daily stress levels, because stress goes straight to clenching the jaw. And finally, just keep track of the exact duration and timing of your pain. Jotting this down in your phone's notes app is like gold for your dentist.
So, the crucial point here is this. Catching these issues early is everything. The whole goal of tracking your triggers, using AI, and getting that initial painless exam is to stop the problem before it becomes a chronic nightmare. Getting evaluated early at specialized centers, like Apollo Dental Nallakunta down in Hyderabad, prevents long-term damage and keeps treatments incredibly simple. We're talking about custom mouth guards, gentle physical therapy, and stress reduction techniques, rather than waiting years and suddenly needing complex, invasive interventions. Persistent jaw pain is absolutely not something you just have to accept as a normal part of your life. As we've seen today, the tools for figuring out exactly what's wrong have literally never been better, more precise, or less intimidating. So trust your instincts. If your jaw has been speaking to you through pain, stiffness, or that painful clicking, answer it by booking a professional consultation. Are you ready to take back your comfort and take back your quality of life?